Patients hardly ever notice that they have clubbing, even when it's severe. They often express their surprise at their doctor's interest in such an unlikely part of their anatomy. Hello and welcome to SRG's Medicine. Today, in this video of Respiratory Medicine series, we shall be continuing our talks on clubbing. So, the contents of this video are conditions associated with clubbing, few important points to be noted, fun facts, and ultimately the summary of this video. So let's start with the conditions associated with clubbing. We could categorize the conditions into two broad headings. The first one being congenital causes and the second one being acquired causes. And since acquired causes consist of a variety of different causes, so it can further be grouped into four categories. The first one being GI causes, the second one endocrinal causes, then comes the cardiovascular or heart related causes, and ultimately respiratory causes. So, for the sake of ease of remembering these categories, we have included a mnemonic here, and that is get her some coffee rather than clubbing. Here I have color coded these mnemonic for your ease. The first one, G for GI causes, E for endocrinal causes, H referring to heart or cardiovascular causes, and R referring to the respiratory causes, and CO referring to the congenital causes, rather than clubbing. And by this word clubbing, it will help us remember that all of these are the categories of causes which are related with clubbing.
Let's look at the conditions associated with clubbing one by one. When we look at the GI causes, clubbing is associated with celiac disease, inflammatory bowel disease, and liver diseases. For this, we have a mnemonic called COILD, where C stands for celiac disease, I is for inflammatory bowel disease, and L is for liver diseases like primary biliary cirrhosis. This is quite easy to remember as gastrointestinal tract is also really coiled. On endocrinal causes, we have thyrotoxicosis, where clubbing is manifested as thyroid acropathy. Under cardiovascular causes, we have two broad categories. The first one being cyanotic congenital heart diseases like tetralogy of Fallot, transposition of arteries, etc. And the second one being infective endocarditis. Under respiratory causes, we have again two broad categories. First one is neoplastic lesions and second one is chronic suppurative conditions. Talking about neoplasia, actually we have n numbers of neoplastic lesions that can produce clubbing as paraneoplastic syndrome. The most common ones being fibroma, lung cancers, and mesothelioma. Under chronic suppurative conditions, we have pulmonary tuberculosis, cystic fibrosis, lung abscess or empyema, and bronchiectasis. So we can remember this by a mnemonic called Fly Me to the Moon.
Isn't this the same song as sung by Doris Day?
Sure, it is. For chronic suppurative causes, we can remember it by another mnemonic called TB celebrity, where TB is for pulmonary tuberculosis, C is for cystic fibrosis, E is for empyema, L is for lung abscess, and B is for bronchiectasis. Now, let's look at some of the points to be noted. The most common cause of clubbing is respiratory cause. The most common respiratory cause for clubbing is neoplasia. Under neoplastic cause, the most common one is non-small cell lung cancer. In developing countries, the most common respiratory cause for clubbing is chronic suppurative conditions of lung. And in children, the most common causes of clubbing are related to non-neoplastic causes like cystic fibrosis, endocarditis, congenital heart disease, chronic airway infection, etc.
So, talking about few fun facts. So, the first thing is that the finger must be inspected from the frontal as well as longitudinal view, so as to get a clear picture, also to confirm whether it is actually clubbing or not. And clubbing, if seen with the cyanosis of warm fingers, is known as fibrosing alveolitis. Here, I focus on the point warm because normally cyanosis is seen with the cold peripheries or cold extremities. But if the finger is warm to touch and there is cyanosis on inspection, and there's also clubbing, then we have to suspect fibrosing alveolitis as a underlying pathology in that patient. Talking about the summary of this video, clubbing could be divided into congenital or acquired causes, Under acquired conditions, clubbing would further be classified as GI causes, which was given by the mnemonic coiled, as gastrointestinal tract itself is coiled. The next cause was endocrinal causes, which included thyrotoxicosis. Other was the heart or cardiovascular conditions, which included the congenital cyanotic heart diseases and infective endocarditis. And the last cause that we talked about was respiratory causes, which we further classified into two subheadings. These were neoplastic conditions and chronic suppurative conditions. The mnemonic for neoplastic conditions was Fly Me to the Moon, and that for chronic suppurative conditions was TB Celebrity. So that's all. Hope you enjoyed it. Please stay tuned. Do like, share, and subscribe for more of these kinds of upcoming videos. And if you have any kind of questions on clubbing or any related issues, please do comment. Thank you for watching.